उसका रहना कीजिए वो सिर्फ पावर पेज ही रहता है फर्क नहीं पड़ता है ठीक है ना उसको बंद मत करिए इसको खोलो sister there's a hand up
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسول الكريم. We are, just for the record, so that you know you're in the right place, we are in session 13G, Elder Muslims in America, Prospects for a Growing Generation. We have a very distinguished and experienced panel of professionals who have been dealing with issues and challenges of elder Muslims. I do want to make very quickly a point about this session and about the topic that we are dealing with. Elder Muslims are both a resource and a responsibility as far as communities are concerned. They are a resource for the community because of their wisdom, their experience, their responsibility of the community because of the needs they may have, whether it's social needs or health needs and so on. At the same time, we have to keep in mind that old age is an opportunity, and we should not be thinking of old age in negative terms. I'd like to think of it in positive terms. We start growing old as soon as we are born, and we are going to continue growing old. Old age in itself is not a disability, although disability may come with old age. I remember one of my friends telling me that he went to his doctor and complained that when he gets up in the morning, sometimes his arm is aching, sometimes something else is aching, and so on and so forth. And the doctor said, if you're over 50 years and you wake up in the morning and nothing is aching, either you're dreaming or you're dead. So something has to happen. But that does not mean old age is a disability. We should look at old age as an opportunity, as an age. A new life can begin with old age. And that's the kind of positive attitude that we want to bring. Now, one way of doing that in practical terms is to create groups of people of that age who can talk to each other, who can be not necessarily a support group in a technical sense, but a camaraderie of people who can share experiences and encourage each other to live a healthy and dignified life. A life that is active, both mentally as well as physically, because one way to deal with old age is that one should remain active in one way or the other. And we do have groups coming up around the country, and you'll hear references to that, and we are trying to encourage that more and more communities should start groups of seniors that can sort of create that camaraderie among the groups, and eventually, inshallah, we'll have a network of senior groups around the country. So I do want to conserve time because we are short of time, and I'll go ahead straight to the panelists. I want to just sort of introduce them. If you have in your program book at the end, you can see their introduction. So I won't take your time for that. Our first panelist is Sister Mona Negm from Maryland. She has been professionally in this business for ages, 40 years, I think, or so more, working with AARP and so on, and she is running an excellent seniors program at the Islamic, the Muslim Community Center in Maryland. Sister Mona Negm.
Thank you, Dr. Unus. It's a pleasure to be here. and thank you very much for coming. I wanted to talk to you about volunteerism. I wanted to talk to you about the need to become a volunteer in your community. Let me tell you what's happening demographically. The older population is growing rapidly, and with that rapid increase, there is also increase in the need for services and long-term care services. And with the increase in the need for long-term care services, there is a pressure on the funding sources. We have the Older Americans Act that is the main provider of funding for senior programs and services will be gradually shrinking. The resources there will be shrinking because of the tremendous number of the aging population and their needs as they get older. So as a result, volunteerism is becoming more and more crucial, and crucial to the services of the Older Americans Act. The Administration on Aging, for example, has a national volunteer resource center, and it is to recruit, retain, train volunteers and provide them with supports. AARP, the American Association of Retired Persons, they have 450,000 volunteers that they deploy and send out at the community level, at the state level, and at the national level and international level. There is no more funding to hire staff. So volunteerism is becoming right now a crucial component of the labor force. So I want you to keep that in mind. For example, I come from Montgomery County, and the county population, the county senior population by the year 2020, I know this is going to be a shock, but the senior population 60 plus will jump to 74% increase. And with that 74% increase, it will be like 1 every 4 person will be 60 plus. And they would require services, and they would require health care, and they would require whatever. So the pressure on delivering the services will become great. And the answer to this is volunteerism. I want to give you just a quick example of a model project that we tried in Montgomery County. And it is a village made up of volunteers. It's a Muslim village made up of volunteers that has become a very successful model that you might consider for the future to do something like this in your community. When I retired from ARP about 10 years ago, I turned around and I discovered that my community didn't have anything for seniors. We didn't have a senior program. By the way, every other group, whether you're talking about Chinese, Japanese, Korean, Christian, whatever religion, whatever, they have complete, comprehensive senior programs for their community, except us, So I went to my community, and it was the Muslim Community Center, and I asked I asked the leadership if I could please start a senior program there. They approved. And I started the senior program by basing it on partnership. And they were all volunteers, but we didn't have any resources. I didn't have any funding. Nobody gave me any money. So we had to develop partnership. I built partnership within MCC with the immediate Muslim community, so that we had Montgomery County Muslim Foundation. We had the Islamic Society of the Washington area. We had the Islamic Center of Maryland. These were right away invited as our partners. We also pulled in public and private agencies and organizations. So we pulled in, especially one of our key supporter and key partner was the Area Agency on Aging. If they couldn't provide us with funds, They provided us with technical expertise, with material, with translated material. So they were key partners in the development of our senior program. And then what we did is we launched a special event, and we brought in community members, and we started asking them who would like to partner in the development of the senior program. And volunteers started emerging. Some were going to do transportation, somebody else was going to do the recreation, somebody is going to organize the food, somebody is going to do a newsletter. Some young people who are computer savvy, offered to start a web page for us and to develop material and design flyers. So before we knew it, we had a senior program. And fast forward, as the program developed and the seniors increased, the participation increased, then we started talking about, well, how do we identify their needs so that we can respond to those needs? And so we ran a few surveys. And from the surveys, a picture started emerging of our senior population in Montgomery County, and especially the ones that we are serving. And the picture was amazing. We had an incredibly diverse community of seniors, of Muslim seniors. They represented 50 different countries of origins. You imagine, with languages and cultures and a level of education, everything, differences. And then we discovered that they were most of them first-generation immigrants. And as such, they've never aged in this country. They don't know what to expect. They don't know how to access services. Even as sophisticated they are, they have never had practice in accessing services. So that was something that was very noticeable. Then we discovered that most of them were first generation, part of intergenerational families. And the majority of them do not consider nursing home as a long-term care option. They just do not want to be put in a nursing home. And then we discovered that they were grouped into 3 different groups. One, and those were the majority of them, were highly educated in Montgomery County, highly educated, very well connected countywide. They're financially independent. They're very active in the community, and they were willing to volunteer. So they became the core of our volunteer team. Okay, and then there was the second group, and those were the vulnerable seniors, and those who came with their, the new older immigrants. Many of them have language difficulty, have cultural barriers. They come in to help their kids with their children, but what happened is that their status become legally tangled, so they have no benefits. They're considered illegal immigrants, and they don't qualify for any benefits, and that gets them in trouble because they come in already with chronic conditions. So we have some serious concern about that group because they need emergency food, emergency shelter, mental health, legal support. It's a whole range of services that they are in need of. And then there is a second group of oops, I'm so sorry. Let me get it. Okay. And then there is another group of seniors who really are in need. And do you know which ones they are? Can somebody tell me? The family caregivers. And especially the ones who are right above the poverty level or are middle class, so that are not covered by any benefits. And therefore, these are the ones who end up financially, physically, and mentally depleted. Okay? So once we've identified the problems and the needs and the concerns of our community, and we had the volunteer, the team of volunteers who's willing to help, then we began to match the the resources, the need with the available resources. And in that match, then we began to develop a communication system, a service delivery system that began to flow easily and slowly. One of the things that we developed, the first thing that we developed was an outreach, an intensive outreach into the community to let them know where the services and where the resources were. So what we did, we trained senior ambassadors, and they were trained by the area agency on aging, by our clinic, to go to learn about the available resources and go into their community and use their own language and share the information with them and give them the publication. And then we trained our imams so that during their Friday Goma prayer, they would preach to the seniors about the available services and where to access them. So we had senior ambassadors, we had, and so that was very important. What happened was we had automatically one senior ambassador who wanted to start a senior program at ISWA. Another MCMF decided to start a senior program with them. A builder decided to build a food pantry for the seniors. MCMF decided to build a food pantry for the seniors. Before we knew it, we were developing a system. And then, of course, MCMF was giving, was reaching out to the interfaith community as well through their volunteers. So they were providing lots and lots, like baskets, Thanksgiving baskets, and Christmas baskets. And we have lots, I'm limited by my time, I'm sorry. But in any case, before we knew it, we had 3 senior programs evolving in our community, 2 food pantries, a system, a service delivery system run by volunteers that reaches out to the senior community and the whole community, but also to the interfaith community to let them know that Muslims are really terrific neighbors. One thing that I want to leave you with is that in order for you to be successful, volunteerism is not enough. You have to have partnership and you have to have integration of services. These 3 are going to become crucial in your community independence, empowerment, and ability to sustain itself in the future, because funding is drying up. It's a pleasure to be presenting in front of you. I am a volunteer and I feel honored to be one. It is such a blessing from Allah to give me the strength and the ability to serve others and to make a difference in other people's lives. I hope you take my message and share it and begin to develop your own program back home. Thank you very much.
Well, thank you very much, and do keep in mind that in any session like this, time is always at premium, but they will be here and you can talk to them one-on-one also. Our next panelist is Dr. Ejaz, Dr. Farida Ejaz. She is a researcher and with 25 years of experience and well-published author also. Please.
Assalamu alaikum, everyone. I, like Brother Dr. Unus mentioned, I have more than 25 years of experience in this field, and I do these sessions, whole day sessions. So it's very hard for me to try to condense everything I'm going to try to say in 15 minutes or 20 minutes, 20 minutes. So I will ask you if you know of certain concepts, and if you do, if the majority in the audience knows, we will inshallah skip that and go to a newer concept. So the Quran tells us to be very kind to our parents, but because children and our nephews and nieces and extended family are all over the world today, sometimes even the children are no longer living in the same city. We are left to try to find services, and Sister Mona has explained the wonderful work they're doing in Montgomery County, and there's no reason why we can't replicate that everywhere else. Now the reality is that most people want to age in place. And may Allah subhanahu wa ta'ala give us all that blessing. The blessing to remain in our homes and to be independent and to die in our sleep. What could be more wonderful than that, right? Not to go to a nursing home, an assisted living, or to die in a hospital. But sometimes Allah wills it that we age and we require services, and He tests our strength. And that may not be possible for everyone. How many of you are familiar and know the difference between Medicare and Medicaid? Raise your hand. Okay, skip. Is it okay if I skip it? If those of you who don't know that, come to me afterwards and I will explain. So let's skip Medicare. Let's skip Medicaid. I have handouts here too and those who didn't get a handout, if you leave me an email, I will inshallah email my PowerPoint to you. How many of you are familiar with the term dually eligible? Fewer people. So the dually eligible are those who are both Medicare and Medicaid eligible, and they are the population that eats up the most of our resources, public dollars, because they are the most in need. They're poor, they are older or disabled So, and there are many programs today to coordinate care, because the coordination of care was so fragmented that it was creating chaos on the part of the consumer and a lot more expenses on the part of the public programs and the government. So let's skip that. If you need services as you grow older, Sister Mona mentioned that the Area Agency on Aging is a huge resource. Look that up in the county where you live, in the city. Try to find the Area Agency on Aging and call them. They can help you with services, and they provide services through the Older Americans Act and other funding sources, as Sister Mona has mentioned. Today, there's a need to coordinate the aging and disability communities because they require similar services. So the federal government has created what's called the Aging and Disability Resource Centers or networks. And these are basically, you can go there, no wrong door, ask for a question. They're housed within area agencies on aging today, are generally what we call ADRC or ADRNs. So this, again, 54 out of the 56 states and 50 states and 6 territories have ADRCs or ADRNs. So call them. And I've listed the list of resources at the end of the slides, the web links. Sister Shaista Kazim is going to talk about in-home services, so I'm going to let her do most of that talking. But in-home services, again, funded by the Administration on Aging, are things like personal care, bathing, grooming, dressing, home care, skilled care, transportation, senior companion programs. These are all services available to you. Most of the Older Americans Act services are free. They are not income-based. There are programs like Medicaid. You have to qualify because you are poor to qualify, and so you can receive those services. Older American Act services are generally free. The only criteria is you have to be over the age of 60. Not a big criteria. Obviously, because there is a struggle, Sister Mona, resources are scarce. They will try to give those services first to the people most in need, and they will look at income. But really, it's available to all. So these are, some of these are, and remember, these services are available in the community because the federal government too wants people to remain at home and receive services. They don't want to place you in a nursing home or an assisted living. It's very costly, and most of the consumers don't want to live there. So the majority of people want to live and grow old at home. Do you know that the majority of care in the United States is provided by family members? 80% of elderly people who need services receive services in the community, and it's provided by friends and family. It's a myth to think that the American population puts their parents in a nursing home. That is a myth. Get rid of that. Even they are going and helping their parents at home. So, and this value by family members of the care that it's provided is estimated at $450 billion. So again, it's volunteers who do this. In terms of home delivered meals, you can get services at home. Again, these are through the Older Americans Act. There are kosher options. If you call your area agencies on aging, and if you call some of the websites and try to work with them, there are halal meal services now being made at King County and Seattle Senior Services. They're providing these meals at very minimal cost. I attended a congregate meal site in Chicago right here many years ago. It was being run by Asian Indians, and I saw the Indians and the Pakistanis were together, and they were serving food like dal, chawal, chapati, sabzi. They were eating the food that we are familiar with, and it was, you pay maybe $1 or you pay nothing. So some of these are free, again, in senior centers or congregate meal sites. Once you start aging, and if you need services outside the home, there are senior centers, there are adult daycare programs. What is the difference between the two? How many people know the difference between senior centers and adult daycare programs? One person. Okay, 2 people. So senior centers are usually independent, elderly in your city. You go, the bus comes, transportation comes, takes you there. There's no reason why a mosque cannot start a senior center and have services brought in through area agencies on aging. Work with your senior centers so that they are more independent. Adult daycare programs, they cost money, generally around $40, $50 a day, sometimes paid for by Medicaid. They are more sick people who are there, and many of them have Alzheimer's and dementia. They come there to spend the day. Think of a child daycare center. This is an adult daycare center. They come for the day there. The bus brings them and takes them back home. Again, they want to live at home. That's why. Then there are independent living facilities, which is like a retirement community. You move to an independent living community. These are usually private pay. So now we are going away from public programs to services that people can afford to pay for themselves. So independent living. There is assisted living, which is a step, requires more care than independent living. Independent living, you live on your own. You could live in an apartment. You could live in a retirement community, and you have your own apartment or your whatever it is, your own condominium or your own house. Assisted living, you have to have a nurse on site. You are provided with 3 meals a day, and you have other services in assisted living. In nursing home, you're the frailest of the frail, and what we call is the oldest, frailest population, the population today that goes in to die there, or short-term rehab or long-term care. So this is how from being very independent to dependent you can move from your service levels. Some people like to stay at home and attend a senior center. Senior center, Sister Mona has explained many programs. Today we are bringing in things like chronic disease self-management programs. These are evidence-based programs that have shown to help improve your health and your physical well-being and your mental well-being. So you have these services sometimes provided there. Things like diabetes self-management or cardiovascular health programs to maintain your heart health, programs like that. Again, these are generally free to attend. They're discounted meals. You can ask for a kosher meal. If a bunch of Muslims go together, they can perhaps ask for a halal meal and have someone cater that. And so again, check with your office on aging, your local department on aging to find out locations. Again, no reason why a mosque cannot start this. Here's an aunt of mine who came in her 70s to the United States. She was so bored at home. She didn't know what to do. Her son asked her to go to our senior center, and she didn't want to go there because there would be all those white American people there. She wouldn't be able to talk to them in their accent. She knew English very well, but her son encouraged her to go. She made friends. Human beings are the same all over. She made friends. She attended the sessions there. She ate a simple bread and butter sandwich when she went there. But she didn't get bored. You could attend, like I said, an adult daycare program where you have some where you have more chronic illnesses and chronic diseases. Some adult daycare programs specialize in Alzheimer's disease and dementia care, so you have someone at home that you're caring for who is driving you crazy because they're asking you the same question 400 times a day. What is the day today? What did I eat? It can make you very stressed. There is this whole body of research that says that people who take care of people with chronic conditions develop illnesses themselves, including mental health conditions like depression and anxiety because they get tired out. So if you send someone away for a couple of hours, don't think it's something bad. You know, you need the break, it's all right. You know, it's all right to use these services. There are also programs for caregivers called respite programs. If you're taking care of an older person or a person with illness, you are entitled to get some respite. Again, through the Older Americans Act, call the Area Agency on Aging or the ADRN or the ADRC, and they can help you get a couple of hours of a home health care person brought to your home who will take care of your mother or your father or your spouse, and you can go and enjoy a movie. You can go and get some respite. You can go for an exercise program. So there is a Muslim adult daycare in New York, and again, some of these, there are privately paid and some have fees, so I've given you some websites to get more information. Like I said, I cannot cover this unless I have at least an hour for myself. But sometimes you need to move out of the house. How many of you are aware of Section 202 public housing? Very few. Again, this is provided by Housing and Urban Development. Chinese, you mentioned that the Jewish agencies, they have all built Section 202 housing with government funding, and people can live there. These are for poor people. The criteria is that you have to be 62 years old and you have to be within the median. So not very poor. In the place where I live in Cuyahoga County, the median income is $24,000 or $25,000 a year. You have to meet that criteria. But there are people who have zero income and who are on SSI, social supplemental income from the government. They are living there. And if you have any income, then you're supposed to pay 1/3 of your income. So if you say you get $600 in SSI, you pay $200 in rent. And some of these are really nice, some of them are really bad. So you have to go and do your homework if you need to move in there. I have had cases where people have called me in the middle of the night and say, I'm throwing my mother-in-law out. I'm not taking her anymore. I cannot tolerate her kit. You know what is a kit? It's like annoying. She's annoying me to death. Now, the Quran tells us to be kind and patient, but in life that does not always happen. We lose our patience. And at 12 o'clock, if I get a call in the middle of the night, what can I do? I'm throwing my mother-in-law out. This is reality. Don't think that it does not happen in our community. It does. It's sad, but it does. So these are options. I have helped people get into public housing, Section 202 housing. They are happy. Their children come pick them up over the weekend, take them home. Everybody is living in peace. The older person has their own apartment and is independent and has self-respect. So these things happen. Again, here is where you can contact. Section 202, the criteria for Section 202 is you have to live alone or with your spouse. You cannot have your niece and your nephew, and you know how we like to bring everybody in and say, oh, big, poor thing, my nephew is in college, he has no funds, I'm right near the college, university, let him stay with me. No, you can't do that. He can come visit you, he can spend a night with you, but he cannot live with you forever. So again, renters could use walkers, wheelchairs, but they should be able to be independent, but they can hire home health care agency staff to come help them, or their children can come and help them cook, but leave them and go. And here is an example of HUD housing section 202 that we have at the Benjamin Rose Institute. You can see the apartments are very nice. Alhamdulillah, we have 2 Muslim people living there, a man and a woman. And one day I got a call from the director of the program who said, Farida, I need your help. The man and the woman don't talk to each other. What can I do? Every time he says, she sells him something that I don't understand, he puts his head down. So I told her that's part of the culture. Don't worry if he's not looking her in the eye and talking to her, it doesn't mean that he hates her. He's just shy to talk to her. And if he's putting his head down when you're talking to him and his eyes are down, he's not being rude to you, he's being respectful to you. So here's section 202. Let me move to independent living. Again, I said this can be private, non-for-profit, run for-profit, but you have to pay for these services. And there's a very exciting new program that I'm going to tell you about. That's the first ever Muslim retirement community being built in Jacksonville, Florida. Brother Muhammad, are you here with the brochures? Brother Muhammad has come down from Florida, but I don't know where he is. He has all those brochures. I'm going to give you some. It's the very first kind of its kind, alhamdulillah. It's called the Medjul Resort Retirement Community. They have purchased 300 acres. They're going to be homes, condos, apartments, halal cafeteria, prayer hall, gym, swimming pool with hours separate for women and men, organic garden close to a masjid, the larger masjid and a Muslim cemetery. Here is a website. Google this name. It is going, they have just purchased the land. In the next 3 years, inshallah, we will have the very first Muslim retirement community being started in the United States, alhamdulillah. If you want to live with your ummah in your old age, this is where you can go. Here is the artist's rendering, how beautiful. At the center is the mosque, as you can see. The center will be the mosque, where people will age in place. Right now it's going to be independent living. And although I think this is more like a resort community, it does not mean that we cannot start things like this for middle income people and low income people. We can, alhamdulillah, do this in our lifetime in the United States and Canada. And then I'll move to assisted living. Assisted living, like I talked about, it's a fast-growing option, mostly private pay for the wealthy, although there are many programs today that they are taking in people who are on Medicaid, and you cannot tell the difference. In one apartment or a room, there could be someone who's a Medicare or a private pay person, and another the Medicaid person, and you are not allowed to discriminate between your services. And finally is nursing homes. There are almost 16,000 nursing homes in the US, but people do not want to live there unless they're really sick. Like I said, the Medicare is for short stays, the Medicaid for long stays, and there is no Muslim nursing home. Eventually, the Medjul Resort Retirement Community is going to build they have plans to build they're starting with independent living, but they have plans to build assisted living and nursing home on premises where they'll have age-appropriate physicians, gender-appropriate physicians and nurses taking care of you, inshallah. And the continuing care retirement community has everything: independent living, assisted living, and like I said, Jacksonville plans to become a CCRC. And with that, I'll end here. Our resources. For those of you who didn't get handouts, there are some handouts there. If you start a sheet of paper with your name, if you didn't get a handout, I will inshallah email that to you.
Can we ask a question?
After the last presentation. So also, if anybody would be kind enough to pick up these and distribute them, that'd be great. The brochures are here. Next.
Is the Medjul brochures here?
Our next presenter is Sister Shaista Kazim, and she runs a senior care home agency. So I'll let her make the presentation. We are running short of time.
Assalamualaikum, my name is Shaista Kazmi, and I am the president and founder of Apnaghar, which is the first senior care agency to address and serve the needs of the elderly South Asian population community in North America. In particular, the Muslim community. The reason I started the company about a year ago was because I was put in a situation where I was taking care of 3 small children, and then my father became ill suddenly, and my mother-in-law was living with us as well. In order to, fulfill these needs and have a caregiver come into both homes, we looked at local senior agencies, and they unfortunately were not fulfilling those needs. Language, cultural, social issues were quite prevalent. I remember the caregivers that came to come in and take care of my mother-in-law had suggested to my mother-in-law that let's go and take a dance class together, and my mother-in-law was literally flabbergasted that she would even suggest such a thing. So, through trial and error, finally I found somebody who could come into the home and, help us out. And I remember at that point thinking, I can't be the only person in this situation. I can't be the only person taking care of my mother and father and my mother-in-law, taking care of my children and working. So I decided to start this company. We have come into a lot of, it's been a great learning process for me. This has not been, I don't have a business background, I have more of a medical background. And what I've done in Michigan is that, just like Sister Mona has suggested, to do partnerships with different local agencies. So we have partnered up with the agency and Aging 1B. We've partnered actually with other assisted livings and nursing homes in the area, so that when a client of ours is admitted into that nursing home or the assisted living, they are provided a companion who speaks their language. They are provided halal food that is to their liking, and many other services. We have found that has helped them adjust in those situations if they have to be at an assisted living or a nursing home. So again, we've formed many partnerships. We've used pre-existing facilities to do this. And then of course we have the in-home care that we offer, which we have aides who are of South Asian background, who are, or those who are Muslims, come into the home and provide that type of care. The 3 topics of discussion that that we were given, one of the things that I wanted to discuss briefly on is the topic of how the youth can take care of the elderly, and that is a very culturally and social type of very sensitive, culturally sensitive topic. Based on, our backgrounds from South Asia, usually it was one person in the home that was working, and the nucleus of the family was the father. And then once, their children, the sons got married, they brought their wives and their children. And you always had type of a caregiver in the home no matter what. As time has gone on and both husband and wife are working, the family dynamics is changing quite rapidly. And we are trying to kind of, ease that transition where we can have those type of caregivers that are culturally similar, and that helps ease that transition again. Respecting your elders, offering care, that's dignified. Once you start losing your activities of daily living, it can be very difficult for the elderly person to, kind of adjust to that situation. And it's the caregiver's responsibility to, be kind, not to have a hurried spirit. And these are things that we're trying to instill in our caregivers as they come into the home. The topic of discussion of elderly care in this country can go on and on for hours. We can talk about how seniors who are able to do volunteerism, as Sister Mona had suggested, offering caregiver groups, support groups for patients who have Alzheimer's, patients who have cancer. These are things that you all can do now in your community. Activities that you can do in your community, such as physical activities. After Jummah prayers, you can have walks. You can, have transportation that can take you to the mall, especially, in those areas of the Midwest and, the East Coast with the brutal winters. You can do all those type of activities, go to the mall and walk and kind of, physically have activities that can physically engage you and mentally engage you. Volunteer within your community, such as starting support groups, having senior programs. You don't have to have something that's very costly. Going into different community centers, just in the library itself, having topics of discussion that are, similar to all your likings. We have one group in Michigan that's called ICANN, it's the Indus Community Action Network, and what they do is they have culturally relevant programs. Last month we had the Eid party where, one of the retired physicians talked about the benefits of fasting in, Ramadan and on the body and how, that's beneficial. Then they had a light lunch. The next month's topic is a mushaira that they're doing. They did a topic on Mirza Ghalib. They go out to the museums. And these are engaging community activities that are culturally, that are similar to what, the wants and needs and desires of the senior community. There's, again, different aspects that can be, used, and like I said, that they can be very cost effective, minimal cost. One of the other biggest things is that you are the greatest treasures of ideas. You have come from, a different place. You have left your, friends, family, culture behind, and you came here and started a whole new life for your families. You can use that, pioneerism and start doing different type of activities, such as, starting, if you have a business background, to help, financially advise, business groups, little business consulting. Retired physicians can, mentor pre-med and medical students. There are many different aspects of volunteerism that you can do. And, I think that each of you has a unique opportunity to do that right now in the community. And one of the last things I wanted to say was that one of the other groups in Michigan, what they have done is they used are just a senior volunteers to go and check up on other seniors. Offer cooking, grocery shopping, household chores, and that's cost effective to the family who's taking care of them. So at least for 2 or 3 hours, that can kind of help alleviate some of the stress and, financial aspects of caregiving. Caregiving can be a whole topic in itself, the caregiving burnout, the skills that are required. And, as I said, that was one of the reasons I started the company. I knew that, there would be a demand for such services, and having people who are culturally similar, who can speak the language, who can understand some social and cultural issues, I think can kind of benefit the community as a whole. We're training those men and women who are from lower socioeconomic backgrounds, those women and men who may have been, women and men who may be in shelters, etc., to kind of help them, get some type of, financial or economic platform. So we're benefiting type of both communities, and I think if we work together, I think, we can make this process and transition an easy one. Thank you so much.
Well, our thanks to our distinguished panelists. We will have some time for question and answer. Let me just point out one thing, though, is that from a positive point of view, one of the things that we worry about at this age is how do you transfer your wealth, whatever little, whether it's small or big, but you want to transfer your wealth, your assets, and so on to the next generation. And there was an article in our paper, newspaper,